There's been an effort here in Bay County for some time to improve access to the whole range of healthcare services that individuals depend upon. People need access, doctors, nurses, social workers, whatever it might be. And that's why the project that we're announcing today is so important, to bring Bay County's great public health programs under a single roof to make it more easily accessible to members of the community. And as we've talked about in past efforts, members of Congress for the last several years have had the opportunity to direct federal resources to specific projects back home that are the priorities of folks back home. So as a part of that effort, I've been able to secure $2 million for Bay County to purchase this building and to begin converting it into a one-stop health complex, which is as I said, that's the priority of the folks right here, and that's what we're responding to. When this project is complete, Bay County families won't have to travel distances between various services. Instead, they'll be able to come right here, get primary care services, connect with substance abuse treatment programs, talk with a social worker, take care of any other health issues that they might have. I'm really pleased that through the community project funding, which is congressionally directed funding through the appropriations process, we've been able to deliver not only this $2 million, but also through the American Rescue Plan, additional dollars that will support this entire initiative. An $11 million investment right here in Bay County will make the community healthier and stronger. And I'm really grateful to for the partnership with Bay County officials, my good friend Jim Barsha, whom I've known for a very long time. It makes a difference when a community comes together and has a vision for what it wants to achieve. It makes my job a whole lot easier, particularly when I find an effort like this, which is really intended to improve health outcomes for Bay County residents by making sure they have access to care. My job is to go get the resources. We've been successful in doing that, and that's what we're here to celebrate. So I want to express my gratitude to everybody here in Bay County and my enthusiasm for this project, and I'm glad that we've been able to be a part of making it come reality. With that, let me turn it over to Jim Barsha.
Thank you, Dan.
You bet.
Dan, thank you so much for your absolutely phenomenal connectivity to Bay County since you were first elected back in 2012. And you have a full year left.
That's right.
To continue to work on behalf of the residents of the 8th Congressional District. And I want to thank you personally for all you've done for Bay County. And this is the latest example of the collaboration between Bay County and Congressman Kildee and our federal delegation in Senator Stabenow and Senator Peters as well for all of the attention and all of the resources that they have brought to our county to enhance the quality of life for all of our residents. As Dan mentioned, this community center, or Health and Human Services concept, is a collaborative and community-based project among Bay County providers that will deliver comprehensive, high-quality health and social services to our county residents in a single location. During the midst of the pandemic, it became apparent that the health department in Bay County had and continues to lack adequate space for clinical and administrative functions, office space, emergency operations center, vaccination locations. At one time, Joel, we had 33,000 residents who had signed up online for vaccinations during the early stages of the COVID pandemic. And of course, that was a challenge, but we got through it, and we had a very high percentage of Bay County residents who were vaccinated and protected, ultimately to reduce the severe impacts of that COVID pandemic and those infections. So other clinical services will be available here, and this very necessary project makes economic sense. A new building would easily cost in excess of $30 million based upon recent estimates. As Dan mentioned, this entire project refurbishes a good quality existing building with a budget of $11 million. As you may recall, Bay County received $20 million in ARP funding, and to show what a priority it was to our residents and our county government, we allocated $9 million of the $20 million that Bay County received toward this project, and then with Dan's assistance, getting a designation in the federal budget under the community project funding, we were able to secure the additional $2 million that Dan brought back to this center for a total of $11 million. As you may note today, it's located in a high traffic, easy to access area of the county and matches the needs and growth patterns of county residents. It brings necessary services to the people. And this is a transformative project that encourages collaboration and innovation. And Bay County has a demonstrated track record in providing leadership and innovation in public health services and transforming human services for its residents. And our primary care clinic received national and statewide attention. And I want to thank Joel Strauss and his team, especially Joel, but his entire team at the Bay County Health Department for his vision, his leadership, and his perseverance on this issue. So we are confident that we will not only meet the needs of our local residents, but demonstrate collaboration and innovation to be an example, hopefully throughout the state of Michigan. And I want to thank all the members of the media for being here, and of course the other significant staff who are here today, and Kristen Giniak, who has also spent a lot of time in developing this concept with Amber Davis Johnson, working very closely with Joel in terms of what we might be able to do to make this vacant building, which is still in very great shape, with an excellent roof, excellent HVAC, great parking, and all the other attributes that I think will serve in this location the needs of Bay County residents for decades to come. So I want to thank everyone for coming out today, and we'll be available later if anyone should have any questions, and maybe take a look around at the massive space that we have here that will be home to, as we have mentioned, a collaboration services for our residents. So thank you.
All right. Thanks, Jim. Joel, take it away.
Thank you and good morning. I'm Joel Strauss, the health officer with the Bay County Health Department. I want to start off by giving my sincere thanks to Congressman Kildee and especially County Executive Barsha for their generous support. And it's, as we've discussed before, it's an $11 million project. $9 million was contributed through ARPA funding, but an additional $2 million from the congressional appropriation, which really helped us put us over the goal line, so to speak, especially in light of yesterday's ball game. So this building is a touchdown. This building, what we want to do is make it the Ford Field of health and human services here in Bay County. We've got a duty to provide public health services, and it's always been a challenge, especially during the pandemic. We didn't have enough space. Our building is well over 80 years old currently, where we're at, 70, almost 80 years old. It has a number of challenges, both space-wise and for modernity issues, but especially for privacy and confidentiality purposes. We've done a lot to correct that, but we need to do a lot more. But one thing that the pandemic brought out was, especially when we were trying to treat persons with communicable diseases like COVID, but that's become much more apparent, is that we need a more modern facility to do that. At the same time, Bay County faces some pretty significant issues with providers, and we have less and less providers in the community. And one of the ways that to think outside of the box to make things more effective is to work together in a single environment. So that's when we're trying to bring innovative, high-quality services together here in Bay County and foster collaboration, not only for other healthcare providers, but other human services providers too. We talk a lot about collaboration, but we need to do it more. We've got a lot of projects in the hopper where we're working with electronic things, like we've got a community information exchange that we're working on with United Way the intermediate school district and some of the other providers here. But nothing beats having services right here in person. And that's what we're going to do with this building. As I said before, Bay County's in need of more providers, and providing services here becomes, as hiring more providers becomes a more expensive proposition. Having a collaborative, modern environment is essential to providing services directly. But as I said before, the key thing is not only just to work with medical providers, it's to work with human services providers too. And so we've been in discussions with a lot of different organizations within the community. And I'm glad to say one of our key partners that we started working on almost from the get-go with this is the CAN Council of the Greater Bay, right? So people don't understand what the CAN Council does. They do a lot. You know, it's not only just Child Abuse and Neglect Council, and Emily will explain more, but it really is an organization that demands collaborative work together and working in a single environment too. And so we're very excited to be moving forward with the project and having them as a potential partner. So without further ado, I'm going to introduce Emily Yeager, the President and CEO of the CAN Council.
Thanks, Tom. Thank you so much. Our CAN Council is dedicated to the prevention of child abuse and neglect through nationally accredited and evidence-based intervention, education, and advocacy programs throughout Aranac, Bay, Huron, and Saginaw counties. We have consistently grown over the past 44 years to meet the needs of our local communities, for our children and our families. In doing so, we have witnessed the significant and various barriers that exist for so many families in accessing services. Co-locating multiple services under one roof minimizes such access barriers, and our CAN Council is pleased to see this project come together for our community. Collaborations such as this allow all of the partners to maximize what they can bring to each individual that they serve, to each child, and to each family. Our CAN Council supports this co-location and will be grateful for all the ways it will improve the health and well-being of Bay County children and families. Thank you.
Well, thank you so much, Emily. And obviously, the message is pretty clear that the Bay County residents will do better when the resources and services that are available to them are brought under one roof. It's more effective, they're stronger together when that disconnect between various needs that an individual might have is erased by the vision of Bay County leaders who decided to make this idea a reality, and we're just really happy to be a part of making it come to pass. So.